Hello and welcome back to the Goodness Lover Show. Today we're talking to Dr. Achina Stein, who's a holistic psychiatrist, to tell us about the functional medicine approach to mental health. She shares her powerful story of her son and his mental health journey, and also the role of the gut and nutrition in improving mental health outcomes. Let's get into it.
Dr. Achina Stein, it's so good to have you on the show with us. We're so excited to talk to you. People loved everything you had to say on the gut-brain solution. So welcome to the show.
Oh, thank you so much. I'm really happy to be here.
So you're a really interesting mix and the perfect mix for the show, actually, in terms of your training and background. How did you get started, or what was your journey like going down this path of functional psychiatry?
Well, I worked as a traditional psychiatrist for 20 years, 15 years. Well, it's been 25, so I have to subtract. So about 15 years. And, just seeing patients one after the other, mostly prescribing medications for my patients. And I also do psychotherapy. I'm trained in psychotherapy as well. So I spent a lot of time trying to understand my patients from a biopsychosocial approach. That's how I was trained to treat my patients. And I basically, searched for whatever methods I could in order to help all of my patients. Spent a lot of time with my patients. And but one day, my son became very ill, and we were actually in France. My husband is a professor, and we took a trip to India and then France on his sabbatical. And so we decided to take the kids out of school and homeschool them, and we traveled all over India and France. And there was a time where we were just sitting and doing some homework, and we were going to go to a little store afterwards to buy some board games. And my son had a little fight with my other son, and he, disappeared from the room, and he suddenly was on a ledge. Uh, we were on 5th floor on the ledge, ready to jump. I don't know if I ever told you that story, but
Oh,
he
wow.
became acutely suicidal and depressed, very, very depressed and suicidal. And the thing is, something changed in him. It wasn't just a classic, situation where he was depressed and suicidal. He also couldn't read anymore. And so something changed in his brain. And I knew this was something more than going on than just a classic depression. And it was like a switch turned because it came out of the blue. And so, when basically, obviously I got him off the porch, off the ledge, and got him once we got home to the US, I had him see a psychiatrist, and he was put on 3 or 4 more medications at the time to stabilize him. Fortunately, he was no longer suicidal. The depression was better. But things in other ways got worse. He started having attention problems, sleep problems. And it was just to the point where, this wasn't my son anymore. This is luckily he was safe. The medication certainly saved his life, but he just wasn't the same person. He was having side effects from the medications. And it's interesting that when you're a psychiatrist and, you're seeing patients for a while, and you think that, okay, well, this is just the way it is. If you have side effects, that's all we can do, or this is the best that we can do with medications. And, I have to say, it was in this place where this is not okay for my son. I mean, I'm not willing to accept this. I need to do more than this. And I always wonder if it wasn't the reading piece, if that reading piece didn't show up in part of his symptomatology, I wonder maybe I would have accepted that this is just the way it is. Because, depression runs on both sides of our family. It's definitely a strong family history. So it's very possible that I may have just said, okay, well, this is the way it is. We'll do whatever we can with medications and psychotherapy, which is what we did. But that piece of not being able to read anymore is what made me think something else is going on. And so I searched and searched, and I talked to doctors, and I talked to this doctor, and I talked to that doctor, and I just wasn't getting anywhere with it. And so I started doing a deep dive of research on my own. And, coincidentally, I happened to also be looking for other options for some of my patients where they just weren't getting better, and I couldn't figure out why. And I knew there's something I don't know that I need to learn. So I was looking into alternative methods of healing. So I happened to serendipitously find a functional medicine doctor, and his name, I always tell everybody his name because he's, he literally saved my son's life and put me on this path had I not found him. And his name is Dr. Edward Levitan, and he has a practice in Newton, Massachusetts, called Five Journeys. And but anyway, so he basically did the functional medicine approach and found him to have celiac disease, and he was nutritionally deficient. He had a whole slew of issues, really. And we had put him immediately on a gluten and dairy-free diet and started moving towards soy. So he got better in some ways, but then we learned that he's actually sensitive to soy. So he had other issues. And then when we got food sensitivity testing, we pulled the soy out of his diet, and he became so much better just by removing those three foods. And what's great about that is that he bought into it immediately because he felt so much better. And the thing is, when you look at root causes, a lot of these root causes are there for years. And so there were symptoms. I always considered him a healthy boy, but he actually had years of constipation, severe constipation, and he had severe eczema to the point where his hands looked like dinosaur hands. I would actually say, he's part dinosaur. When he was 4 years old, he knew all the names of the dinosaurs. He's like, "You're part dinosaur. Look at your hands." So, but those were the symptoms that cleared up. The constipation and the eczema completely went away within a couple months, completely. So that's where, because he suffered from that, so he saw that got better. So generally, mental health symptoms take much, much longer. So, so he bought into the whole thing. Once those got better, those symptoms got better. He started eating. He used to not eat any vegetables or no vegetables except for corn, but he mostly ate pasta, milk products, all white foods, all of them white. I think the only vegetable at that time that he ate was broccoli. So, which is a good vegetable, but you need to eat it. A lot of vegetables.
You take broccoli, right?
Yes. So it was definitely a big change for him in terms of trying all the different foods, and he actually took to it nicely. There's a lot of kids who really fight tooth and nail when it comes to that. So that, and we treated his gut. And certainly with the celiac disease, we had to do a whole gut restoration. But it took a good year for the depression to completely remit and come off medication. My times might be off. I've been interviewed on so many podcasts, like my times are probably already like off, but because it's been 10 years, it's been 10 years now, but it took longer. It took longer.
Watch out if anyone's like sleuthing in all your different podcasts, Dr. Achina. She was like, on this one, she said it took 18 months.
So it took longer for the, the anxiety and the sleep. But he finally came eventually off all medications. He was on an antidepressant. He was on a benzodiazepine. He was on, what else was he on? He was on Adderall. and I know there was a fourth medication, but I can't remember it right now. But he was on 3 or 4 medications, but he was able to come off of all of those medications in about, I would say, in about a year. And he did continue with some psychotherapy, but overall, he did really, really well. Um, that doesn't mean to say it stayed that way. He went to college, and of course, your friends want to go out to the Chinese restaurant. Chinese food has soy in it. So he started putting soy back into his diet, and cheat here, cheat there. And then you're up like vampires until 2 o'clock in the morning and drinking. And then there's exams and the stress of that. So by the end of college, he was a complete mess. But as soon as he graduated from college, he got back on. He knew the thing about functional medicine, is that once you know what works, you know what you need to do. So he knew exactly what he needed to do to get back into the swing of things. And he did, and so he's doing great again. So
amazing.
What a story.
Yeah.
And I guess it's amazing to hear that story. And unfortunately, though, a lot of people don't have that sort of story. Obviously it's amazing that you're able to get the help that you could get. And we celebrate that. And maybe someone listening right now hasn't had as much of a heartfelt story. And this is what we want to give you hope from these interviews, is in the sense that, change can happen. It's the smallest things, like those little sensitivity testing and like those little things you discovered were huge to turning his mental health around. So I'm curious to know how this experience framed your pursuit as a doctor and your approach as a practitioner.
Oh, yeah. I mean, of course, once you go through that, you just can't unknow what you just learned. So I obviously, what I literally did is I asked Dr. Levitan if I could work for him, and I left my job. I was the medical director. I was the medical director for a community mental health center for from 2004 to 2010. And when we went to Europe, we came back to that job. And I just, I basically asked him, like, I have to learn this. I have to do this. I need to do this for my patients, as well. And so I pursued training through the Institute for Functional Medicine, and I became a certified practitioner. So, and so I worked, at the time it was called Visions Healthcare, until 2015. And then once they closed, I opened my practice, Functional Mind, in Rhode Island. And I've been doing that ever since. Awesome. So, I basically, I did write a book, called What If It's Not Depression? Because so many people have this idea that once you have a diagnosis of depression, of course, it's, this whole spectrum of symptoms that you can have, from having the symptom of depression and then, going across to the clinical depression. And then there's, of course, different severities of depression that you can have, to the point of having even psychosis. So, the functional medicine approach can help all people in that spectrum. Certainly people who are on the milder side are going to recover much quicker than the people who are on the other extreme side, because, many people who are on the extreme side are usually on multiple medications, and then there's different levels of functioning. So the thing about functional medicine is that it does take work. I mean, it's not just popping a pill. You have to make changes in your life, and so it is work, and you have to be willing to do that work. And so when people call to work with me, I mean, I have a free consultation, and it's really to sort of let people know, like, are you willing to do 1, 2, 3, 4, 5? Because if you're not, then, you don't even waste your time with, I'm not going to waste your time. I'm not going to take your, I'm not going to, take you down this road and then, surprise, this is what you need to do. It's like, so, I want to make sure that they know what they're getting into, which is why I actually wrote the book, because So when people call, it's like, oh, I heard about functional medicine. They don't really understand what it entails. So I say, like, well, read my book, and then you'll get a really good idea of what you need to do. And then I'll guide you through it. So it's one thing to be able to read something, but then to actually implement. I mean, like, there's thousands of self-help books out there, right? What's the difference between reading something and actually making it happen? It's having a coach, essentially, to walk you through it, and to sort of be your cheerleader, but ultimately, I would be your guide, but you're doing the work. Right? So it is making major lifestyle changes, and for some people it's not so major because they've already implemented, they've already watched your videos and learned, oh, well, I'll put in greens, and I'll add proteins and fats, because you start learning and you start adding things in, and then start exercising and getting standing desks and just getting out of your chair and moving as much as possible. There's all of these things that you can do. So my approach is basically the classic functional medicine approach, but it's to target symptoms of depression and anxiety, and it's basically removing all of the things that can cause inflammation in your body. And so the understanding is that your gut is connected to your brain through the vagus nerve. And you want, if you, everything really starts in the gut. And if you can reduce inflammation in your gut, then you're, going to reduce inflammation in your brain. And obviously that's just one root cause. There's going to be other things that can cause depression. Your environment can contribute to depression. That your relationships, if they're toxic on some level, can contribute to depression. If you've had past trauma, that can contribute to depression. Just general dissatisfaction in terms of purpose in your life. There's multiple things that can contribute to depression. But I find that if you can get the foundation of the gut in order, everything else kind of falls into place. So we're removing what's causing inflammation, replacing what's missing in the body to work optimally, have all of your organs working optimally. And it's also looking at in terms of digestion. Digestion is so important. It's amazing how many people don't really understand how important digestion is important for assimilating all of the nutrients. Assuming that you're putting all the right foods in your body, you want to make sure that you are releasing the digestive enzymes and the bile acids and the hydrochloric acid to break down all of that food and assimilate through the gut lining. And it's those proteins, those amino acids, that actually are manufactured by your gut microbiome to make the neurotransmitters that your brain needs. So we're removing what's causing inflammation, replacing what's missing, re-inoculating the gut microbiome, and then repairing the gut lining. And so 80% of your immune system is in your gut, and 80% of your serotonin is made in your gut. So if you can get those organized and, start manufacturing in your gut, then your brain's going to, definitely benefit from that. And so there's 5 areas that I look at in terms of removing inflammation. We start with food. And then there's infections. There's chronic infections, foods, infections, toxins, stress, and those 4 all can affect your hormones, particularly cortisol. Cortisol is a major hormone, a stress hormone, essentially. And if your body is requiring constant release of cortisol, then that's going to eventually affect your sex hormones, because you need cortisol to survive, and it's going to pull from progesterone and estrogen and testosterone, depending on whether or not you're a man or a woman, to make cortisol. And so it's really important to figure out, well, what's causing that that cortisol to increase, and look at all those factors. And again, inflammation is a major cause, but what's causing the inflammation? So if you can get your cortisol levels down and inflammation down and bring the body back into balance by shifting your body, and that's what those 5 areas spell. So stress, hormones, infections, foods, and toxins, then you can really bring the body back into balance. So that's it in a nutshell. Some people that I work with, it takes a good, I would say, 4 to 6 months to do all the work. Some people take longer because there are some issues that if you find are gonna take longer. And I always use the analogy of, like, if you wanted sort of an estimate of how much it would cost to put an addition on your house. They'll look at it and decide, oh, it'll be X number of dollars. And then they start taking down walls. It's like, oh, you have termites here. Well, this is going to take longer because we got to get rid of the termites. Or you have mold, you have mold behind this wall. There's been, water damage or something because of the roof leaking. And you don't even realize that until you just start, pulling things apart. And it's the same kind of thing when it comes to functional medicine, is that you start pulling things apart, and there are things that can take longer. You'll find that that person has Lyme's disease, or they have other tick-borne illnesses, or they have mold in their body, or mold exposure, mold in their house. And so obviously those kinds of things, when they pop up through your investigation, that's going to extend how long it takes. So some people have small intestinal bacterial overgrowth. Some people have significant trauma, that they really need to address in psychotherapy. They might be already addressing it in psychotherapy, and they're seeing a psychotherapist and they come to see me for the functional medicine. But that's something that if you're, it just takes longer when it comes to trauma, because especially if you're always triggered and you're constantly in fight flight, then I always say you need to put meditation on the front burner, especially. So part of my intake includes the ACE score. I don't know if you're familiar with that, the Adverse Childhood Events Score. That helps me to know right away, we need to put stress reduction on the front burner. And I cannot believe how many people aren't informed about meditation and emotional freedom technique, by their psychotherapist. I mean, those are really good tools to help with trauma and all of the negative things that you might say to yourself over and over again, day in and day out. Being able to look at your cognition and being able to use tapping and meditation and deep breathing to try to bring down inflammation that's related to emotional toxins, right? So there's a lot of tools out there to help you, to know what really you need to be more aggressive about in terms of like trauma, So it's there's so many things I could talk about.
That's great.
I could talk for hours. I'm sorry.
So many things. No, it's great. Thank you. So we have the S.H.I.F.T method. Essentially, you're saying the 5 letters. S was stress. T
Stress.
trauma. Was that? Oh, sorry.
Yes.
I can spell.
Stress.
S-H hormones.
This is going on YouTube, Sarah. And she's the most Nazi speller with me.
Let's edit that out.
I'm finally vindicated.
What? Inflammation? Was inflammation?
I is for infections, chronic infections.
Okay.
Yeah.
And then F.
Foods.
And then T.
Toxins.
Awesome. I love it.
Yes.
I remember in a series you started off by saying that you often don't test your clients anymore that have depression, anxiety for their nutrient levels, because you've seen such a common thread across so many of your patients that you've seen. You can basically just guess what nutrients they might be deficient in before you even look at their panels. Could you tell us what are those common nutrient deficiencies that you see across your patients with mental health disturbance?
So in general, So, we just want to make sure people don't start taking these nutrients just because I say so. So, but in general, people are magnesium deficient, zinc deficient. They tend to be high in copper. So there's this copper zinc ratio. We want to have a 1-to-1 ratio. And some people are low in zinc and high in copper. And some people are selenium deficient. The B vitamins it's important to look at all of the B vitamins and have a complement of B vitamins. So there are a lot of people who focus on B12 and folate specifically for a variety of reasons. There's this hyper focus on those two B vitamins, but a number of people are deficient in vitamin B6. And B5, B2. So it varies. It depends on the person. So people who are very fatigued tend to be B2 deficient. People who don't have dreams, that's a sign of knowing if you're B6 deficient. So yeah, and B12 and folate are commonly tested in the serum. But that doesn't necessarily mean that you have enough of those vitamins, because it may not necessarily be getting into the cell. So there's ways of knowing whether or not it's intracellularly deficient. Whoops. I just pulled my earphone out in my excitement. So anyway, there's ways of knowing, looking at, you can look at your tongue, you can look at your fingernails to know if you're deficient in certain vitamins. If you have little white spots on your fingers, you could.
Now we're paranoid.
Everyone look at your fingernails right now. Talk us through what we should be not seeing on our fingernails, Dr. Achina.
So little white spots tend to indicate zinc deficiency. You can actually take some zinc, actually a little swig of zinc. And if you don't taste it, if there's no taste, then you are zinc deficient. And if you have a taste, then you have enough zinc. So so there's different ways of knowing without doing, a full panel. There's inexpensive ways of doing. If you have ridging on your fingers, that could indicate, little divots in your fingers, fingernails. It can tell you if you have certain kinds of vitamin deficiencies. So it's a matter of looking. So many times when people are seen by conventional doctors, they tend to just listen to the heart, lungs, they look in your mouth and your eyes, ears real quick, but they don't really do a full physical exam, certainly not necessarily looking for nutritional deficiencies. So that is something that's important to do, in my opinion. You can find clues, and it gives you just more information, and it also informs the patient, like, wow, these things are really showing up in my body. It makes it more serious for them, and then you can actually, when you start eating foods, those white spots disappear from your nails, and your nails become shiny, and those ridges go away, and you can actually see a difference in your nail beds and your tongue too. So absolutely,
Awesome.
Amazing.
There's a lot you can learn
Great
from
mental
looking
health and beautiful nails at the same time.
Absolutely. That's the beauty of this approach, is that it's not just your mental health that gets better. Everything gets better. Really, everything gets better.
So a lot of people, this is myself included, the journey of mental health began with perhaps a conversation around, serotonin in their brain, and they may need some SSRI support for a period or for a longer period of time. So tell us how you work with your patients on that. If someone is perhaps, maybe they've come into your practice and that's their understanding that they've just got an imbalance in their brain. They haven't looked at their gut. How do you walk them through that? And maybe what's that process like of them transitioning off SSRIs, if that's the decision to make it?
Mm-hmm. So, there's going to be situations where a person does need an antidepressant. And, it's going to be an individual decision looking at all of the benefits versus the risks of, the medications. And, certainly I do a full psychiatric evaluation to determine whether or not this is something that would be beneficial to them. Part of that decision is obviously whether or not the person wants to take medication. Um, there was a time when I would tell people like, you know, you really need to be on an antidepressant because you're not functioning, you're not able to take care of yourself. I mean, there was a time when I would, have to put people in the hospital and because they're just not able to, they're losing weight or they're psychotic or they're just not able to care for themselves and really on the verge of dying, if they continued in that way. So there was a time when I needed to do that. Nowadays, most people who come to see me, they have already been on antidepressants. They are not satisfied with the results of the antidepressants. They've moved from one to the next, to the next, to the next, or they've had side effects and couldn't tolerate them, um, significant side effects sometimes, or they'll have just, 40% results. They're feeling better. Maybe they're enough to function, but their mood is still, I just I can't live like this. I want better results. And so sometimes people will, come to me because they're looking for more. They're not satisfied with just an antidepressant, or they just can't take it, and they aren't offered anything else to be able to resolve their symptoms, and they just don't want to continue living the way they're living. So that's who I see now, and so I'm not anti-medication. In fact, I think I mentioned to you that yesterday I said to one of my patients, like, you're not able to do the work that you need to do because she was actually hypomanic and was recommending that she start a trial of lamotrigine. And so it's been interfering in her ability to do the work that she needs to do with me, but also interfering in her ability to, work with people on her job. So she was functioning, but just screaming at everybody. So, including me. So, but anyway, it's like, you know what, your mood is really unstable. We've tried it with herbs and supplements. We've tried it for 3 months now. It's not working. We really need to get you on a medication in order for you to feel better and not be so distressed and be able to do the work that you need to do with me. So sometimes you need to be on medication to be able to even do the functional medicine approach. So that being said, what we do is, first, I always tell people that it's better and it's much easier to come off medication if and when you want to, after you restore the gut, because what the medication is doing is providing a supply of serotonin because your body's not able to. So if you start getting your body to make serotonin in the way that I explained before, providing the raw materials, getting your microbiome going, and get those manufacturing going and calming down the inflammation and repairing the gut lining, then you're actually getting those factories going, and then it actually makes it easier to come off the medication. And that's two reasons, because as much as some people want to come off of medication, they don't have the confidence because they've tried before and they've had horrible side effects, or they would get acutely depressed or anxious after coming off of that, within weeks to months later. And so back on the medication. And so it's like, that is torturous. And so people remember that and they don't want to do that. So if you do the gut restoration while you're on the medication and you feel so much better, then in your heart, it wasn't because the medication did it. It was because of the work you did to make that happen. And so then with confidence, obviously the medication didn't do it because it didn't change. So therefore, I'm just going to now be able to come off of it. And so then what we do is slowly reduce the medications. And depending on what the dose is, if they're on a relatively high dose, I always say you need to go slow, very slow. And as you go lower on the dose, you go even slower. So that's the general way of doing it. And we can help those transitions of lowering by giving certain supplements to help with any type of transitional types of symptoms, which are called uh, discontinuation syndrome or withdrawal. It's a withdrawal syndrome that some people have. Some people have more severe withdrawal than others. The withdrawal sometimes can last 24 to, let's say, 72 hours, but others, might have a little bit prolonged. So if that is the case, then you want to go right back up to the previous dose and then go even slower, So that's generally what we would do. And I do use some supplements, and this is something that really should be done under the care of a provider who understands how to do this. Things like 5-HTP, tryptophan, because you do have to be careful about serotonin syndrome. But there's also things like GABA and L-theanine that help with the anxiety piece. There's inositol, there's L-glycine. These all help with sleep, with the anxiety, and withdrawal types of symptoms. And so,
What do you mean by serotonin syndrome?
So serotonin syndrome is something that it can happen if you take multiple medications that can increase serotonin. It's too much serotonin. So SSRIs can interact with other medications, like migraine medications can increase serotonin. So that's something that we as psychiatrists are careful about combining medications, or should be careful about. But if you add 5-HTP or tryptophan, that can increase serotonin. So the combination of an antidepressant with that, especially if it's too high, it can actually cause too much serotonin, and it's a syndrome of different symptoms that doesn't really feel good.
Yeah, it can be quite dangerous as well, right?
It can be, yeah, it can be dangerous. So sometimes though, and it's a much more of a problem if you're newly started on an antidepressant. It's a little bit different if you've been on an antidepressant for a long time. And when I say antidepressant, I mean specifically SSRIs. There's other classes of antidepressants that it's not such a big deal, but specifically SSRIs, you have to be careful about serotonin syndrome. So
I guess this is all to make them, obviously the very clear point that work with someone that's a qualified medical practitioner in your area, and use this information for education to, to equip yourself to be to have that informed conversation, I guess is what we're saying, right? In the sense that we don't want anyone jumping off their medication or anything, but definitely I think just these small things like we talked about with this functional approach can make a huge difference. And this has been obviously our own personal experience as well as yours, but also, thousands of others that have been through our community that have just found that one thing, and all of a sudden their mental health clears. And after all these years of trying during different therapies and whatnot, and bang, the light globe, the light globe moment happens. And this is amazing, which is why, we're so passionate about this, people just being informed with these areas.
Absolutely. And what's great about it is that, when they look at having a clinical diagnosis as really being a diagnosis of symptoms, the diagnosis is nothing to do with cause. And the purpose of creating diagnosis is really to match a pill to that diagnosis. It's really for purposes of research, to convey information from one practitioner to another about what syndrome a person has or what disorder a person has, and to match a pill to that diagnosis, because there's research that shows this medication is good for this diagnosis and that medication is good for that diagnosis. So it says nothing at all about what caused the problem in the first place. And there's so many causes, and you can have multiple root causes, and all at the same time. So my goal is, as I said, it's looking through that shift method, stress, hormones, infections, foods, and toxins, and really looking for all of those and removing them one at a time. And, as people are doing the work and, becoming more and more aware of how they feel as they're doing it, they'll say, oh, my mood really changed when we did this. And then, in the future, and this, I always have my patients keep a journal. Then, in the future, like when my son, went off to college, and it's like, okay, what worked before? Let's do that again. You have your notes. Yeah, it's just do it again. You know exactly what affects you and how it affects you and what changed when you made the changes. And so you have your own personal history to go back to fall back on, and know what to do. So yeah, it's I think it's really important to convey to people that there is hope, that you're not, you know, labeled for the rest of your life, with a diagnosis. And then, sometimes people just feel hopeless and helpless about the situation, and they think that that's all they can do is take a medication. Now, there's nothing wrong with taking a medication. If it works for you, fantastic. And if that's what you want to do, great, good for you, but that doesn't necessarily mean that's working for everybody. And it's, I think it's your choice to do what you want to do. And there's no shame in that. There's no shame in that, because everybody has to look at their whole life and review what they have time for, what they, they might have all sorts of responsibilities that they are unable to do this kind of work right now. Maybe they can in the future, So I don't think anyone should be, judged for their decisions, about how they're going to conduct their life, as long as they're not hurting anybody else. I think, it's important to provide options. And this is an option if you're willing to do the work. And personally, I think it should be an option that should be put on the table right in the front,
Yeah.
before medications, especially if it's a mild depression.
On our call last week, we had a coaching call with our community, and you mentioned a bit more. You went into a bit more detail about mild depression and antidepressant SSRI prescriptions, and you were of the opinion that the pros in that case didn't outweigh the cons. So what is the deal with a prescription for SSRIs or antidepressants on mild depression?
Well, the research shows that it's really not appropriate to give an antidepressant because the risks outweigh the benefits. And there are other modalities that are actually even better, like exercise. Exercise is equal to an antidepressant for moderate depression. So there's so many side effects from antidepressants. It can cause gut symptoms by itself. It can cause diarrhea, nausea, upset stomach. It can cause weight gain. Depending on which ones you use, it can cause sedation. It can actually cause a hypomanic or manic episode. In certain populations, like the teens, there's a black box warning about suicidality. So, why wouldn't you use other methods first? And so it's the thing is, it's a quick fix. It's something that a doctor can offer. What they do is a little quiz called the PHQ-9, something like that, a family doctor's office. And, if you fill a number of the criteria, then you will then be offered an antidepressant, because in their mind, the benefits outweigh the risks. But they're not doing a full psychiatric evaluation, and they're not really, because in 15 minutes, you can't really do that. So a lot of family doctors do prescribe antidepressants, and, they're trained to do it to a certain extent. And then generally they'll, depending on the severity, they might refer to a psychiatrist. But in my opinion, I think what really should come first is dietary changes. I mean, as long as the person is safe, if they're safe and they're functioning, they might have some distress, but if you can use diet and lifestyle changes to address these issues, then why wouldn't you?
Mm.
So it's a matter of sometimes connecting the dots, because it is explaining to people how exercise treats depression, so explaining to people how food is medicine and what foods can improve your mood, and how to do that. But unfortunately, again, that's functional medicine, that's nutrition, that's these are all things that most medical doctors aren't trained in. So I hope that someday there's going to be this marriage of the traditional world and the functional medicine world. That's I think where it should be, but it's not, unfortunately. So
Well, I think that's why we're having this conversation right now, because I think you've done that marriage really well. Like you're in both worlds. You see the benefits of both, and I think thank you so much for distilling some really complex, sensitive, personal information into something that people can really action and start with today. And I really hope it gives a lot of people hope and perspective, and at least just that option if they want to assemble that team around them. Maybe it's a medical doctor included. It's you have a team of people around you that could be looking at some of these core issues, and you might just then have a more informed decision. So thank you so much. It's been an amazing interview, and I think I wish I watched this like 10 years ago.
Yeah.
Oh, you're very, very welcome. Yeah. And I don't want people to think that they are, that they could only benefit from functional medicine just if they had mild or moderate depression. Even people with more severe symptoms will always benefit from eating healthy foods, or exercising or meditating or removing toxins and getting all your organs, working optimally. It might take longer, but it's certainly doable. Absolutely, it's doable. It will. I say might. It will take longer. So, but it's not impossible. And I've had some patients for 4 or 5 years now who have made incredible strides. So who had been on 4 or 5 medications and now are on lower doses, and so that's improved side effects in terms of side effects, but not able to come off medication, or they've been able to come off maybe 2 of the 5 medications that they were on. So it's everybody's different, and it's just everyone has their own journey. But just want everyone to know that everybody can benefit from functional medicine, even if you make one change at a time.
Awesome. Well, I know that you have some awesome resources for us on the interwebs, one of them being your book that you've made available to download on your website, which is amazing. Thank you so much for that's so
Generosity.
wonderful that you've put that up there for free. And I think that's just incredible. So thank you. So people can access that via, what's the URL?
Well, it's www.achinasteindo.com. It's ACHINASTEINDO.com. And there's another website. It's whatifitsnotdepression.com, which is
Your boot camp.
My boot camp. Yes. And so it's a 12-week boot camp, and it's really meant for those people who do have that mild to moderate stable depression, who are in that category of dissatisfaction with antidepressants, but kind of just going along, and they want better results, or they just don't want to rely on medications completely. So and that's actually starting this week. And so keep an eye out for the next one. I'm taking a couple more people. I don't know when this is going to be aired, but be great if we could have some more people, but we'll see. Yeah.
For sure.
Awesome.
Yeah.
What a great resource.
100%. We'll check out. We'll have those links in the show notes, obviously. if you're on the audio
Yeah.
version of the podcast. And yeah, thank you so much for your time. This has been an amazing interview. Thank you so much.
Oh, you're very welcome. Thank you. Thank you for having me.
I really enjoyed that. It was
Yeah.
good. Really
What
good.
a woman.
So good. And yeah, what did you guys think? Let us know in the comments below. Do you think a functional medicine approach is important for mental health outcomes? Let us know. We'd love hearing from you. And yeah, I'm just so happy that I got to, my doctor introduced me to some of those concepts early on in the piece. And I'm sure a lot of people would benefit from the same as well. So get this message out, share it to your friends and family, hit the like button, subscribe button. And if you're a really good student of the Goodness Level Live, hit the notification bell so you don't miss another episode.
Ding, ding.
And we'll see you guys again soon.
See you next time.